Hey guys, glad you're here. Welcome, and I'm glad you've decided to learn about the benefits and risks of physical activity for diabetics. So we'll go ahead and dive right into it. So first, we're going to talk about what is physical activity, and it's defined as any bodily movement produced by the contraction of skeletal muscles. And so you use physical, or you will probably often hear people use physical activity and exercise interchangeably, and they're actually slightly different terms that describe separate things. So physical activity is just that any bodily movement produced by the contraction of muscles, whereas exercise is more intentional, it's structured, it's repetitive, and it's done in order to improve or maintain components of physical fitness rather than just simply moving around to perform tasks. So moving on here, excuse me. A lot of people have some cynicism and a little bit of skepticism about will physical activity really make a difference in your life? And I'm here to tell you that it will. So if you are someone who's skeptical about the true efficiency and the effects of physical activity, you're not alone, but you have lots to gain, especially if you're a member of the diabetic population. So as we get into it here, there is in fact a dose-response relationship between physical activity and weight loss, physical activity and abdominal obesity, and physical activity and metabolic and overall functional health. So a dose-response relationship means that an increased exposure to a stimulus results in either an increase or a decrease in the outcome. So in context of this situation, an increased exposure to physical activity results in an increase in the health outcomes listed above, which would be the weight loss, the abdominal obesity, and the metabolic and functional health. So, contrarily, high levels of sedentary behavior or prolonged periods of sitting have an unfavorable effect on glucose and insulin control. So people with these high levels of sedentary behavior also suffer an increased risk of diabetes, heart disease, and cancer, as well as increased risk of mortality from all three of the aforementioned conditions. So physical activity will make a difference pretty immediately in your life for the better. So how active should you be? This is going to differ on a person-to-person basis. It's going to be more individualized, but there are some standard guidelines that we're provided with here. Since 1995, the CDC and ACSM have recommended 30 minutes or more of moderate physical activity on most or all days. So about 5 days, it's a business week for adults. And so 30 minutes a day for 5 days a week, that's 150 minutes total on a weekly basis. This can be substituted for 20 minutes of vigorous activity for 3 days out of the week. So that's 60 minutes of vigorous activity on a weekly basis. And so you can have a combination of these two different factors. So it's perfectly fine to alternate or combine moderate and vigorous activity levels on a weekly basis, and you can still meet the guidelines this way as well. So some of the terms I mentioned, meaning light, moderate, and intense or vigorous physical activity, are all landmarks for how intense the activities you're doing are going to be. So a lot of people will have a hard time kind of determining what each intensity is. And so what we have here is we have them divided out into three different categories: light, moderate, and vigorous. And as you can see, it's followed up at the end with something called METs. So these are metabolic equivalents, and it's a really good measure that we use to quantify the intensity of different activities. So we have these, and they're a great measure. You can use them to measure lots of physical activities, but they may not make a whole lot of sense in a practical context, especially if you don't really know what we're talking about here. So as we move on to the next slide, at the top of this chart, you can kind of see, or the table here, I have light intensity, moderate intensity, and vigorous intensity as well, with the METs listed afterward. But underneath, we have some activities that would qualify for each of these categories to make it a little more practical to understand. So for light intensity, we have walking slowly, such as around your house or in the store, light work, household chores that you can perform standing up, such as making your bed, washing the dishes, ironing, etc., and leisure sports such as billiards, darts, and fishing. So they're all going to keep you active, but they're not exactly strenuous. As we move on to moderate intensity, we have walking 3 miles or walking at a brisk pace. So brisk is going to be different from person to person, but just anything that's going to get your heart rate elevated and up. Not exactly extremely strenuous, but not a light walk either. Heavy cleaning activities such as washing the car or windows, sweeping or mopping, and mowing the lawn. And then leisure sports such as golf, table tennis, or just shooting a basketball and not participating in a full game. And then tennis doubles as well. And for vigorous intensity, we have walking at an extremely brisk pace, so probably just below a jog, really getting that speed up. Hiking at a moderate pace or at a steep grade, either one of those will work. And running, obviously. And then we move on. We have heavy farming, gardening of high intensity, maybe some extreme gardening if you're into that. Shoveling and carrying heavy loads, swimming, soccer, cycling, tennis singles, not tennis doubles. So the single aspect of it kind of increases the intensity, or participating in a basketball game. So you might be asking after the last slide, what type of activity is best for you? So there's two main types of exercise that we're going to talk about here. One being aerobic training, one being resistance training. So resistance training is defined as an exercise using a resistive force for the purpose of enhancing muscle strength and mass, as well as bone mass. So you get two benefits there, as well as some aesthetic benefits. And then we have aerobic training, which is physical activity that increases the heart rate and the body's use of oxygen, typically prolonged for about 30 minutes. And so a really interesting fact is evidence suggests that resistance training is actually equally as effective as aerobic training in the management of type 2 diabetes. And so this means that whenever you're choosing which type of exercise you want to engage in to help yourself, you actually have an equal choice of either one. Neither one's going to necessarily be better than the other one. In terms of just the standard. So at a personal level, you might want to choose one over the other, and that's going to come down to your own health and abilities that need to be assessed prior to participating in any of these activities. So kind of continuing on here, diabetics may suffer from symptoms such as blood glucose irregularities, diabetic peripheral neuropathy, and insulin resistance. So if you've encountered any of these issues or have anything, that's kind of what we're going to tackle here. So physical activity increases glucose uptake, which in turn lowers blood glucose levels. So what that means is whenever you're actively exercising or participating in physical activity, your body's going to need increased levels of energy. So you have an increased energy need. And the way your body meets that is by uptaking glucose from your bloodstream to provide energy to your muscles. So the more vigorous your activity is, the longer duration your activity goes on for, your body's going to require more glucose. And that's going to in turn make your levels decrease as it sends that glucose out to your muscles. And so similarly, physical activity can also increase insulin sensitivity in individuals. So muscle contractions that occur during exercise activate that glucose transport into your muscle cells, and that can be done without insulin being released. Insulin is a hormone that's released through your pancreas, and that's what normally stimulates glucose uptake. However, exercise can have the same effect without the presence of insulin, which is extremely helpful for individuals who become insulin resistant or have constant hyperglycemia. So one complication we can run into is diabetic peripheral neuropathy, and that's also one of the things I mentioned at the beginning of this slide. This peripheral neuropathy can cause nerve damage and a decrease in muscle strength. So this is an excerpt from PubMed. It's an abstract on a research study that was done, and this is regarding the effects of exercise on diabetics and specifically dealing with peripheral neuropathy. So I'm just going to kind of summarize this for you guys. What they did was they had 24 diabetic neuropathic females that were randomly selected and divided into two experimental and control groups. So the experimental group had resistance aerobic training for 3 sessions over an 8-week period. The exercises included resistance exercises with 2 to 3 sets, 6 to 7 exercise stations, 8 to 12 reps or repetitions of the exercises, 3 to 5 minutes of rest in between each one. The aerobic exercises had 50 to 65% of the heart rate reserve for 3 minutes with 30 seconds of rest intervals between sets and 5 to 10 reps or repetitions. And so what they found at the end of the 8-week period was that upper body strength did increase, but not significantly, while the lower body did show a significant strength increase. So that's a benefit right there. In addition to, as we talked about, the progressive nature of the diabetic peripheral neuropathy. So progressive nature just means as you have it, the symptoms can worsen over time. And so even small changes resulting from the combined exercise can be useful. So that means this is a case of something is absolutely better than nothing. So even if you're kind of hesitant and you don't exactly know how well you have the capacity to exercise or how much endurance or things you have like that, something is certainly better than nothing. And the sooner you get out there and get started, the better off you're going to be. So again, just kind of summarizing here, and then I left a citation in case you guys would like to go and read up more on this subject yourselves. So now we're going to jump into the risks we have associated with physical activity for type 1 and 2 diabetics. So as with any type of physical activity, there are going to be risks associated. I know a lot of people probably get nervous and think, I don't want to fall out, I don't want to pass out, or you might just be scared of the intensity. So there are certainly risks associated. However, it should be noted that a lot of people tend to overestimate the risk of exercise, and the benefits of habitual physical activity substantially outweigh the risks, meaning you stand to gain much more from exercising than you stand to lose from exercising. That being said, participants should always be appropriately evaluated. Make sure you're checked out by an exercise physiologist or someone certified before engaging in anything above very light intensity exercises. And that's if you're sedentary. Non-sedentary individuals, people that already exercise or participate in physical activity on a regular basis, you can work your way into moderate intensity activities, provided that you don't have any known cardiac conditions or family history of such conditions. If you do, you definitely want to get checked out before you engage in any type of physical activity, just because the risks for you could be a bit higher and they're going to be a little bit different than people that don't have any type of history with these types of conditions or anything like that. So, as we talk about risks associated, I gave you kind of an overview on the last slide. So this one, we're going to tune in specifically to diabetics such as yourself. So here's some of the unique risks you may experience. One of the most common ones is going to be hypoglycemia. We talked about the glucose uptake before, and now it's going to be an increased energy need for your body as you're engaging in these activities. And so as your glucose can actually get too low for your body to function where it wants to, there are going to be some symptoms associated with that, such as low blood glucose. And the symptoms include shaking, sweating, dizziness, blurred vision, confusion, and heart palpitations. And that last symptom, heart palpitations, is actually a really nice segue into the next one, which is going to be a cardiovascular event. That's another risk associated here. Excuse me. Strenuous activities in general, you're going to have an increased heart rate, which in turn is going to increase the risk of you suffering a cardiovascular event. Again, this is where you want to make sure you got checked out, you know yourself and your pre-existing conditions. But paired with the heart palpitations mentioned above, the results could potentially be more severe than they would have been on their own. And then lastly, we have foot complications. Diabetics who suffer from neuropathy need to take extra precaution when engaging in physical activity due to the foot problems they already have. This can cause balance issues, increased foot pain, foot numbness, prickling sensation, things like that, and even weakness or muscle atrophy, and that was something that we mentioned from the abstract before, how the lower body strength of the diabetics in the neuropathy study actually increased with resistance and aerobic training. That being said, definitely avoid high impact activities such as sprinting or jumping that may further the symptoms you're suffering from. And this is actually our last slide. I do have a handout for all of you guys to take along with what you've learned here today. I hope everything you learned here is helpful for you. Definitely reach out if you have any questions, and I'll provide that handout as well. Thank you for joining us, and I hope you make the decision to start your physical activity immediately. Thanks for joining.